Hello everyone, this is Dr. Mounisha, obstetrician and gynecologist at GIMSR hospitals. So today I'll brief you regarding the problem statement, that is the portable device for the fetal movement count monitoring. So first of all, we'll discuss regarding the importance of fetal movements, what are the physiological changes and biomechanical changes associated with the fetal movements, so that it will help you and guide you in making your device. So fetal movements is an important sign of life. A mother can feel as early as 16 weeks of gestation in a case of multigravida, or 20 weeks of gestation in a case of priming, that is a first time pregnancy. And this is the first sign of life a mother can feel, and this helps in making an emotional bondage to her baby. So, and as an obstetrician, it will help us in assessing the neuromuscular development of the fetal, neuromuscular development and neuromuscular integrity of the fetus also. So, usually we will advise the patient to maintain a fetal movement count charting. That is, we'll advise the patient to monitor the fetal movements in a day, in an entire day, at least 15 to 20 movements in a day we can consider as normal. We'll advise the patient, if there is any decreased movements, to report to the hospital or to the clinic as early as possible if she has a decreased fetal movements. So are the movements uniform throughout the day, or the movements uniform from person to person? No, it varies from person to person, and it varies, the number of movements varies, also varies according to the time and duration in a day. Okay, so some babies will be more active in the mornings, and some babies will be more active in the evenings. So we should not form a blanket statement like having these many number of movements is normal. So we should explain the patient. We'll usually, as an obstetrician, we'll explain the patient that having these number of movements is good for the normal development of the fetus. Okay, and whenever the mother experiences a decreased movements, we'll advise her to visit the hospital, so that we'll monitor her further and we'll investigate her further. Okay, but sometimes what happens is mother might be too busy to count the fetal movements, or maybe the obese patients, in some cases of obese patients, she may not be able to perceive the fetal movements normally as a normal lean person. Or in case of anterior placenta, that is, the placenta is located on the anterior abdominal wall, so that mother may not be able to perceive the fetal movements. Even though baby movements are there, she may not be able to perceive the fetal movements. Or in a cases of polyhydramnios, that is increased amniotic fluid in the amniotic cavity, in those conditions also baby movements will be there, but mother will not be able to perceive the fetal movements. This will increase the emotional stress on the patient, and she need to get the repeated hospital visits and repeated evaluation for the decreased movements and all these things. So here comes our part as a to make a portable device which can detect the fetal movements, and it should maintain a log, and it should send an alarm to the mother in case of decreased fetal movements, and to the obstetrician also in cases of decreased movements. So why it is important, decreased fetal movements is important, is decreased fetal movements acts as an alarming sign for fetal death. So if we ask some patients who had a previous deaths, they will recall at least 80 to 90% the patients will recall a history of decreased fetal movements just before the fetal death, having the fetal death. So that is the importance of maintaining the log and charting the fetal movements. So what are the kinds of fetal movements? Fetal movements can be a simple flickering movements of the muscle, or twitching movements of the muscle, or a flexion and extension movements of the at the multiple joints, or a respiratory movements can be a fetal considered as a fetal movement, or a rolling movements, or a kicking movements over the uterine cavity. Those are all the things we can consider as the fetal movements. Okay, and if the mother experiences the decreased fetal movements, we will advise the mother to visit the hospital. We will confirm the fetal heart rate, and she should undergo a cardiotocography, CTG, where we will monitor the fetal heart rate. In a fetal heart rate in the CTG, we will perform for 20 minutes. So we'll see the pattern of fetal heart rate, baseline variability, baseline fetal heart rate, variability, number of accelerations, number of decelerations, and all these things we'll see, and categorize the CTG as a reactive, so that if it is a reactive, we can reassure the patient that her baby is well. And if it is not reactive, so there is any decelerations or there is no accelerations, or where there is a poor variability in the fetal baseline fetal heart, then she should undergo a ultrasonography and get the Doppler studies, that is the uterine artery Doppler, middle cerebral artery Doppler, or umbilical artery Doppler, and all these Doppler studies of the fetus. And we'll see the biophysical profile for the baby. So for all this to undergo, the mother has to visit she should have a number of increased number of hospital visits, and it will take a lot of emotional stress on the mother also. So this device, whatever we are going to have, they should monitor the fetal movements and send a signal to the mother, and there is a decreased movement, so that she can come immediately and reduce the unwanted consequences like intrauterine deaths, so that we can prevent those and give a healthy mother and a healthy baby at the end of the pregnancy. So there is a lot of research is going on these aspects, like changes, monitoring the changes in the pressure, intrauterine pressure, or non-invasive fetal EEG monitorings and all these things. So we can work on all those things to monitor so that we can work on the physiological and biomechanical changes that are associated with the fetal movements to make your device. Thank you.